We have about 6 to 7 order on our order paper, unlike yesterday. So we are hoping that they will serve us up to the midday. The House is called to order. Any petition? See none. Any report of the select or standing committee? See none. Any report and paper? So see none. Any motion? My apology. Any notice of motions? Honorable Sikulo.
Honorable Chairperson, honorable members, good morning. Honorable Chairperson, I hereby give notice in terms of Rule 54 of the National Council setting rules and orders that on Monday, the 24th August 2026, I shall move the report of Amsat Regional Council for the 2025-2026 financial year. I so move.
Thank you. You may sign and table the notice. Thank you so much. Any further notice of motions? Thank you. Honorable Nano.
Honorable Chairperson, honorable members, good morning.
Morning.
I hereby give notice in terms of Rule 54 of the National Council Standing Rules and Order that on Monday, the 24th of August, I shall move the report of Punena Regional Council for the 2025-2026 financial year. I so move.
Thank you. Please table the notice. Thank you. Any further notice of motion? Honorable Johnson.
Honorable Chairperson, honorable members, good morning. I hereby give notice on behalf of Honorable Alfred Edward Wambo in terms of Rule 54 and Rule 56 of the National Council Standing Rules and Orders that on Tuesday, 25 August 2026, he shall move the report of the Hardap Regional Council for the 2025-2026 financial year. I so move.
Thank you. You may sign and table the notice. Any further notice of motion? See a hand of Honorable Katembo.
Honorable Chairperson, honorable members, good morning. I hereby give notice in terms of Rule 54 of the National Council Standing Rules and Order that on Tuesday, 25th August 2026, I shall move the report of the Kavango East Regional Council for the 25-26 financial year. I so move.
Thank you. You may sign and table the notice. On a lighter note, honorable members, there is too much silence in the chamber. I'm worried. Yes, at least. Okay. Yeah, at least, yeah. Honorable members, any further notice of motion? Honorable Chaveunja.
A very good morning, Honorable Chair, Honorable Members. I hereby give notice that in terms of Rules 54 of the National Council Standing Rules and Order, that on Monday, 24th August 2026, I shall move the report of the National Council Standing Committee on Education, Science, ICT and Youth Development on its engagement with key stakeholders in education, science, youth development held in Ochuarongo from the 6th of July to the 10th of July 2026. I so move.
Thank you so much. You may sign and table the notice. Thank you. Any further notice of motion? The same hand again of our Honorable Chaveunja.
Thank you, Honorable Chair. I hereby give notice that in terms of Rule 54 of the National Council Standing Rules, in order that on Tuesday, 25th August 2026, I shall move a motion on the need to harmonize Namibian's Presidential National Assembly, Regional Council and Local Authority election, as well as the immediate assumption of duty of the presidents and all elected officials. I so moved.
Thank you so much. May sign and table the motion. Honorable members, any further notice of motion? I see none. Thank you. We shall proceed. I now ask the Secretary to read the first order of the day.
Introduction and motivation of the report of the Karas Regional Council for the year 2025 2026 financial year.
Thank you. Honorable Joseph, are you ready to move the report?
I'm more than ready, Honorable Chairperson.
Thank you. Any objection? Agreed to. Honorable Joseph, you may now table the report. I thought you were going to give him some support of some kind. For having attired himself very well. You may go ahead, Honorable Joseph, in motivation of the report.
Thank you, Honorable Chairperson. Good morning once again, colleagues.
Good morning.
Sure. I really needed that support. Thank you, Honorable Chair. Honorable Chairperson, Honorable members of the National Council, I have tabled a report that primarily focuses on activities carried out by Karas Regional Council. However, I deemed it necessary to present to this House a consolidated report on the state of the Karas region, drawing from the Karas Regional Council report and the State of the Region address. In doing so, I bring before this House not only a record of achievements, but also the realities, the pressures, and the expectations of the people we serve. Honorable Chairperson, the Karas region stands at a decisive crossroad. On one hand, it is increasingly positioned as a strategic contributor to Namibia's future through green hydrogen, oil and gas, port expansion, agriculture, mining, and cross-border trade. On the other hand, our communities continue to live with daily realities of poverty, unemployment, infrastructure backlogs, and institutional capacity constraints. It is within this tension between promise and hardships that this report must be understood. Let me begin with the progress that has been made. Across the region, the Council and the partners have delivered important infrastructure and service projects that are already improving lives, and the report can clearly detail all the project activities that took place in 2025-2026 financial year. Honorable Chairperson, the report also reflects positive progress in the rural electrification, sanitation, and land servicing, human capital development, and social protection. Honorable members, development is not only about infrastructure, it is also about people. At the same time, the region continues to support thousands of citizens through social grants, early childhood development support, and community-based relief mechanisms. This reminds us that a compassionate state is one that stands with its most vulnerable citizens. The weight of the challenges. Honorable Chairperson, while we celebrate progress, we must also speak honestly about challenges. The first challenge is poverty and unemployment. These remain the twin burdens that continue to rob our people of dignity and opportunity. Young people in particular are waiting for pathways into productive work. Families continue to struggle under pressure. Many communities still face the harsh reality of inadequate income, limited services, and fragile livelihoods. The second challenge is implementation delays. Several projects are slowed by delayed invoice processing, procurement bottlenecks, and weak administrative responsiveness. A project that is planned for one financial year must not drift into the next without clear accountability. The third challenge is institutional capacity. In the drought relief program, for example, the region faced shortages of warehouse facilities, inadequate staffing, logistical difficulties, and weak data management. These are not minor issues. They are directly affecting the state's ability to respond to human needs. The fourth challenge is security and law enforcement pressure. Karas continue to face cross-border crime, drug trafficking, stock theft, gender-based violence, and other criminal activities. The clearance rate of 41% from 4.3 reported cases is commendable under difficult circumstances, but it also reminds us of how much more remains to be done. Honorable members, challenges of this nature cannot be addressed by rhetoric alone. They require focused leadership, disciplined administration, and sustained parliamentary attention. The importance of oversight. This is why I wish to place particular emphasis on parliamentary oversight. Honorable Chairperson, honorable members, oversight is not a ceremonial exercise. It is a constitutional responsibility. It is through oversight that Parliament ensures that public resources produce public value. It is through oversight that we hold institutions accountable. It is through oversight that we insist that projects are completed within their allocated project cycles, not years later, not after the damage is done, and not after the communities have lost confidence. A budget is not successful because money was allocated. A project is not successful because it was announced. Success is measured by delivery, impact, and transformation. We must therefore ensure that ministries, agencies, regional councils, and local authorities are held account for timely implementation, proper expenditure, measurable outputs, and real benefits to communities. If public money is invested in water, then water must flow. If it is invested in roads, then roads must open access. If it is invested in housing, then families must be housed. If it is invested in skills, then young people must be employed. That is the standard we must demand. As I'm concluding, Honorable Chairperson, Honorable Members, Karas is a region of great potential and great responsibility. We are witnessing progress in infrastructure, education, health and land reform, and social protection. But we must also confront the unfinished business of development: poverty, unemployment, underperformance, and delayed implementation. Our duty as elected representatives is not merely to admire progress, but to protect it, strengthen it, and ensure that it reaches every household, every settlement, and every citizen. Let us therefore move forward with urgency, with discipline, and with a renewed commitment to accountable governance. Let us ensure that the promise of development is not limited to policy documents, but becomes visible in the lived experience of our people. People do not ask for luxury. They ask for dignity, they ask for opportunity, they ask for service, and they ask that government deliver what it has promised. Let us rise to that responsibility. And through that, I humbly ask this August House for the adoption of this report, and I so submit. Thank you so much.
Thank you. Honorable members, further discussions on the report. Karas Regional Council report. Okay, Honorable Janse, did I see your name? Your hand?
Honorable Chairperson, thank you for the opportunity granted. Good morning once again. Honorable Chairperson, I rise to seek the concurrence of this August House for the postponement of the report from Karas region to be debated only on Tuesday, the 25th of August, 2026. I so submit.
For Tuesday. Any objection? Agreed to? The report of the Karas Regional Council has then postponed until Tuesday, the 25th of August this year. Honorable members, the Secretary will read the second order of the day.
Introduction and motivation of the report of the Kavango West Regional Council for the 2025-2026 financial year.
Honorable Sikongo, are you ready to move the report?
Yes, Honorable Chair, over ready. There comes a time.
Thank you so much. Any objection? Agreed to? Thank you. Honorable Sikongo, you may now table the report. You may go ahead and motivate the report.
Thank you, Honorable, Honorable Chair, Honorable members. Kavango West existed as of 2013 with 123,000 people, 622. 76.5% represent the youth, 2.9% population growth rate, 58.5% unemployment rate. The region is 99% rural, with Nkurenkuru as the only capital city, Katwitwi the only settlement thus far. Development. Kavango West honorable members, I can see all of you are happy. You have got pens, you have got books, you can read, you can analyze. Just because you went to school and you are educated, that's why you can analyze any document that was given to you. So Kavango West is still championing when it comes to education. First position for NSS CA as advanced subsidiary, position number 1 for 3 consecutive terms. I need hands, honorable members. And for the third position, NSSCO ordinary level, we are still championing the third position. I also need your hand. So we are moving with the development. Vocational Training Center have opened its door with 170 students. Civic Affair, a new brand new office, opened its door on March 2026 this year. Kavango West have got a strategic plan 2025-2030 aligned to NDP 6 and also the manifesto for the current system. Kurenkuru Nepara Road, 10-kilometer low volume seal is open to the public. Kavango West Office Park, a beautiful office, now is operational as of May 2026. Katwitwi also is a settlement, have opened 25 houses to its residents, and 2 development green schemes are continuing, which is Msese and Sikondo. As we are speaking, if you travel from Rundu to Kurenkuru or to Hangwena, you will see at Msese heaps of maize. Those heaps that you will see are not soil, those are maize. So we are producing as because our region is a food basket, and we are just doing that. Future priorities. Kavango West Regional Council has prioritized 19 roads, starting from the first road, District Road 3446, District Road 3469, 3427. They are all proposed to be low volume seal, all 19 roads. So The challenges that we are encountering in the region: staff shortages at Home Affairs. Unfortunately, at Home Affairs, we only have one staff member who can speak the vernaculars. That make it very difficult for elderly people to acquire documents, because all officials that are there only speak English. Unfortunately, our elders not all of them speak English. Two, region need a magistrate. Currently, the magistrate is commuting from Murundu to Kahenge. The land has been made available by Nkurenkuru Town Council free of charge to the Ministry of Justice. The land is idling thus far. We want the ministry really to construct the magistrate office so that we can sing the song on our own. Three, there's shortage of social workers. Four, delays in offset payment by the Ministry of Environment when hippos and the elephants are damaging the crops. The payment is always very much delayed, and we want a speed for that. Shortages of service land in Nkurenkuru make it very difficult for residents to acquire houses. Limited fund for Nkurenkuru for compensation so that they can pave way for new developments is also a thorn in the flesh. Delay in the construction of a district hospital, so women are still singing the song of Bob Marley. No woman no cry, no woman no cry. Accommodation for vocational center is still a challenge because the only classrooms were constructed, but the vocational centers does not have accommodation. All 190 students are coming from home. So we need accommodation there. Shortages of petty cash at Mangeti. Mangeti is our diamond. Unfortunately, currently, they cannot even afford to buy diesel for their cars to move from cattle post to cattle post to do the vaccination. They need the petty cash. Lack of full-fledged hostel in Nkurenkuru as a town is also make it difficult for all learners to be board learners coming from home all the time. Shortages of towers or MTC towers for networks coverage in part of our constituency becomes still a challenge, and we need the 100% MTC tower coverage to be effected. 12, 140 villages are still without water provisions. Got the Ministry of Plans only to drill 2 boreholes, but while 140 does not have water. A number of boreholes drilled for 5 years ago were not yet installed. Infrastructure were not yet installed. That make the community still traveling 31 kilometers to the nearest borehole. Ministry of Urban and Rural Development and the Surveyor General is delaying our declaration of our 5 growth points. We want the speedy, these 2 ministries need to come up so that they can speed up, because we waited almost 5 years now. Recommendations: 188 schools be awarded to 2 green schemes for school feeding program, because we have enough food. These 2 green schemes can feed 188 schools. Road priorities must remain as it was prioritized by the regions. It must not be tempered, please. Transport shortages at Directorate of Rural Water Supply and Sanitation Coordination be addressed in the midterm review. Budget cut remains a thorn in the flesh for Kavango West. We requested 180 million. We were allocated 55 million. And if you take 40.7 million for personnel expenditure, you are remained with a 2 million. And there's nothing in the region you can do with a 2 million. I now ask this August House to accept and adopt Kavango West report. I so move. Thank you.
Thank you so much. Any further discussion? Honorable Muteka.
Thank you very much, Honorable Chairperson, and we thank Honorable Sikongo for that wonderful report. We are also happy to hear that there was a incorporation of some of the lyrics. Unfortunately, Honorable Chairperson, I don't know how to sing. However, I wish to seek the concurrence of this House that we postpone the debate on this report to Tuesday, the 25th of August, 2026. I so submit.
Thank you. Any objection to that? Agreed to. The discussions on the report for Kavango West Regional Council stand postponed to Tuesday, the 25th of August. So agreed. Honorable members, the Secretary will read the third order of the day.
Resumption of debate on the report of the National Council Standing Committee on Health, Social Welfare and Labor Affairs on its oversight visit to Oshana, Oshodonjupa, and Omaheke regions on the effects of Hubbly-Bubbly from the 13th to the 31st of July 2026.
When this debate was adjourned on Wednesday, the 19th of August 2026, the question before the Council was a report by Honorable Sikongo. Honorable Ndawanifa adjourned the debate and he has now the floor. Honorable Ndawanifa.
Thank you very much, Honorable Chairperson, Honorable members. I rise to resume the debate on the report of the National Council Standing Committee on Health, Social Welfare and Labor Affairs following the oversight visit to Oshana, Chozonzupa and the Omaheke region from the 13th to the 31st of July 2026. The findings of the committees are based as follows. The committee found with deep concern that the Hubbly-Bubbly and vaping products are increasingly affecting school children and youth mostly. Learners as young as primary schools, but of course secondary schools as well, are being exposed to flavored products. Flavored products in terms of tobacco and nicotine products, leading to addiction, poor academic performance, respiratory system or problems, and risk behaviors. Peer pressure and social media influence and easy access to in community have normalized this dangerous habit among the youth. Honorable Chairperson, honorable members, this is a crisis that requires an urgent attention and united action. Parents must play their role by monitoring their children, creating open communication at home, and reporting the sales of these products to minors. Schools must strengthen the counseling services and involve parents in prevention and rehabilitation efforts. Honorable Chairperson, honorable members, the government interventions must be decisive. The government intervention must be decisive. Therefore, according to the report, the committee recommends as follows. 1. A ban of advertising and promotion and display of vaping of Hubbly-Bubbly products. The National Health Education and Awareness campaigns through TVs, radios, and social media should be enhanced. The standardized school guidelines to prevent, detection, and reporting with trained life skill teachers providing psychosocial support. Confidential cessation support for young people who want to quit. And lastly, the establishment of a multi-sectoral enforcement task team to monitor compliance and emerging trends.
So now some closing thoughts on these new TISO PRX
Our
38.
children are not experiments. We may not keep watching as they are making use of this hybrid bubbly, and we consider it
millimeter
as an
models. So I
experiment,
am somebody
good
that
experiment,
has been able to, again,
but we must
basically
consider
review
serious
every
concept.
single PRX
Because
variant that
there
has
are
come
some
out in the
risks
last
associated
5
with
years.
this
And we are
hybrid
coming
bubbly.
up on 5 years
What most
in
important
2026,
is to
early
say,
2026. That'll mark the
inhaling
anniversary
this type
of the
of
PRX collection,
smoke
which is pretty crazy. It's almost been a
affects their
blur.
ability to
It
think.
feels like the PRX
Like I
has only been around
indicated,
for a
it
short period of
affects their
time, but it also feels as if it's been around
But
forever. And in some cases that is
because
true
their
because it is a
ability to
historical
work,
model,
their
looking back to the
ability to engage their
1970s, but
families
its
will be
impact on the
compromised.
collector community
Therefore,
under 1,000.
the banning of hybrid bubbly is a right proposal and the right decision to take by this August House so that we make sure that we protect the future of our children and young ones. Therefore, honorable members, I therefore urge this August House to adopt the committee recommendations without delay. Therefore, honorable chairperson, honorable members, I do so submit to this August House to adopt this very beautiful report and to be ready for the implementation. I thank you, honorable chairperson.
Thank you so much. Any further discussion? Maybe we have to start with the non-committee members before we go to the committee members. I see Honorable Chavionja's hand. Your mic.
Thank you very much, Honorable Chair. I miss my friend sometimes during these discussions. A very good friend, brother, Honorable Debele. Why I miss him today is that because I want to use one of the quote from the Tswana tribe that says that if something is being backed by big dog, then you must not concern yourself that much because it might be very far from your house. But the moment that you see the puppies are barking, then you must be aware that it's about to enter the house and you need to take whatever action you need to take. Why am I saying this? This happily-bubbly issue is a very serious issue. It has been coming. And what is strange to us is that some of us, privately, we engage members from this committee after they went and visit different regions. What we are experiencing nowadays, this happily-bubbly is being smoked in classes while teachers are teaching lessons. Because of the flavors and everything that they are having, and even how they have designed, it's now in a format of either a pen or a pencil or whatever for that matter. So the teacher will be then thinking that this is just a pen that this child is carrying, but at the end of the day, the child is smoking the happily bubbly while the teacher is teaching. So the teacher will just be concerned with the smell of bubble gum and all the other funny things. Thinking these kids are playing with bubble gums, but in fact, they are smoking this happily bubbly. What I wanted to add is that we are in a serious crisis. Recently, there were recruits, the new intake from the Ministry of Defense. One of the recruits passed on when he was part of this exercise. And when you get some of the information is relating to the use of this substance that our children are using. The only challenge that I'm faced with is that, Honorable Chair, Honorable Members, we are so good to regulate and put in laws, but then we don't have the support system thereof. Because what we need is that, you see in big countries, sometimes they even allow a child to abuse alcohol, but they have remedies in place. The unfortunate part, we are not that privileged because of the background and the history where we are coming from. So we are challenged. So what I wanted to, Honorable Chair, Honorable Members, is that when you look at Botswana, they went ahead with this issue of the happily bubbly. It has been, what I wanted is that it need to be added to the tobacco regulations. Let it be regulated in our country. What I mean by regulating it is that then we can control it much better. At the level where we only think that let's make a recommendation and then put it at the level of children, we might not really serve the purpose. Because the unfortunate part, our children are affected as young as 12, 14-year-olds that are smoking these things. And when I was also reading the record that of Botswana that I like, so they have even increased the smoking age in Botswana to 21, from 18 to 21. So somehow you force to regulate these things better, and also the regulations thereof of selling it, where not every shop, because this bubbly thing, now you can buy them as you are going to buy maize meal and milk in any shop. It's everywhere available. So we are challenged, and then seriously, I think that as a nation, there are many things that we need to do. Honorable members, being the chairperson of the Education Committee, we are equally disturbed by the discipline of our children. And also how it's been regulated, because as we sit now, it's only the executive director who has the power to authorize the suspension of a child from a school. Not the school principal for that matter, not the inspector in that circuit, not even the regional director. And this process, it's only within 14 days after whatever crime have been committed or offense have been committed. And when you look at this and the process that have to happen, in most cases, the time lapse. So seriously, there are things that we need to revisit. And what I pick up one, honorable members, that I could remember is that our children are enjoying these things like eating cakes. They are even calling it, especially if they happen to be suspended from school. Apparently they call it a smoking break. That week or two that they are not at school, it's a holiday break, a smoking holiday. When they come back, the others are asking, how was your smoking holiday? So that's how seriously we are disturbed with this happily bubbly and all the other substances that we are facing. And also one want to really be serious when it comes, as regional councillors, when we are on the ground, we drive around, you pass by a house, the parents of that specific children, of those specific, they are sitting there. The kids are smoking in front of them. Maybe they are convinced, been told these things is not harmful. Maybe it's just like all the other toys that they are playing with. But seriously, maybe when we strengthen the regulation and making sure that we regulate these things at the country level and also put strict restrictions, we will then solve this problem. Because I'm not lying, some of these things, when you have things and it's been done mostly by boys, somehow you are not that step. But the moment it affects the girls that we think are the future mothers, to the extreme it have really infiltrated in their society, it becomes a serious challenge. So with that submission, Honorable Chair, Honorable Members, I think we need to see how we can present this happily bubbly recommendation and whatever we are going to add on it and make sure that it does not, I don't want it to be treated as other normal reports that we are doing, because here we are dealing with the safety of our learners, the safety of the future leaders. So with the support that we are going to give to this report, we really want to know that from here, what are we going to do? What is the serious contribution that we are going to make sure that this happily bubbly, and I will also maybe be a happy man if I have to go to my grave one day, knowing that this happily bubbly has been completely banned in our country. Because what hurt you is that in most cases, even the people that are producing this, they are not the biggest smokers. It's us who are consuming this. So they do this, we produce them. When it comes to experimenting it becomes our babies. With that submission, I really also support the report, but my only concern is that we need to create in something that will be very punitive going forward was to address the issue of happily babri. With that submission, I thank you, Honorable Chair.
Thank you. Any further discussion? Honorable Unona.
Honorable Chairperson, honorable members, I rise to contribute to the Hambiri Babri.
Yes, it's a new word. So
yes, Hambiri Babri. I also would like to appreciate the Standing Committee on Health for the well-presented report and for the well done for the activity that they have took to examine how Hambiri Babri is affecting our nation. Hambiri Babri is an enemy to the future of this country. If we cannot take a control on a time, it means that we are not going to have future leaders. We are not having to have people who could be able to think and people who could be able to do something in our country. But the concern is that Hambiri Babri, it's having a stage when affecting the health of a person. This substance is harmful to the health of a person. There is a stage where a person could even affected by cancer. And there is a stage where a person could also get serious sick, and the result is death. Which means that if we cannot take a serious action to ban these harmful substances in our country, Namibia will be empty one of the day. And Hambiri Babri substances are not coming from anywhere. These substances are being imported from foreign countries to Namibia. And they are available in our shops, in the market. There is a need for the Ministry of Health, in collaboration with the Ministry of Safety and Security, to make up a strong campaign and also remove all these substances from our shops, so that at the end of the day, we are no longer going to crying of having these substances which are harmful to our health. There's nothing we can do without taking an action. And the recommendation from the National Standing Committee on Health need to be implemented as soon as possible. And we need also to have a law that banning these kind of substances in our country as soon as possible. There's no need of delay. We need to take an action immediately to save our children, to save our people, and also to provide the future generation. Otherwise, the generation of Namibia will end at our age. Whatever you have children in your house, they are going to end up as non-productive people. They are going to end up in graves because of these substances that are harmful to our people. I raise this concern to support the recommendation that are on the table, and also
to request the Parliament to act immediately so that the all kind of harmful substances should be banned totally in our country and to be removed. With that, I so submit and I support the recommendation.
Thank you so much. Any further discussion? Honorable Amjindi.
Thank you very much, Honorable Chairperson, Honorable Member. I'd like to thank the Standing Committee of Health and Social Service for carrying this oversight on habit bubbling. But what I want to say is that this is a very serious health effects using this habit bubbling. It damages the lungs, it damages the hearts, and damages the brains, and in most cases, it causes disease like asthma, bronchitis, and the reduced lung functions. It can also cause infectious diseases, which means that most of the young people, they are sharing this one. Sharing a mouthpieces substances, it can also spread TB or hepatitis. So in most cases also, this habit bubbling damages the concentration of our young people. It damages the memories, and also it can reduce the learning abilities in the terms in our arenas. Therefore, law enforcement need to be strictly enforced for fining those are selling habit bubbling to the learners or to the young ones. I can even propose, for example, anyone who found to sell this to the young ones, they should be fined 50,000 Namibian dollar or a fine of 6 months imprisonment or both carried together. We fine 50,000 Namibian dollar and the fine 6 months imprisonment so that we can very strictly tighten the law to make sure that our young people are protected. And also there is a need to put a graphic warnings on habit bubbling, just like on the cigarette packs. Why they don't put graphic on this one, like it's put on the cigarette packs? There's a need to put that one. Again, this is not just a responsibility of the government. It's a responsibility for everyone to learn campaign of the dangers of habit bubbling. Media campaign is need also to be used, like to use TikToks to tell the learner or the young one the dangers of these ones. Radio should carry the campaigns, television should carry the campaigns against this one, as well as any other social platform, so that this message can reach across the board. And the learner also, they should understand that 1 hour on habit bubbling is equal smoking 100 cigarettes at a time. They should understand that just to spend 1 hour using habit bubbling, 1 pack of habit bubbling is equal, just 1 pack or 1 hour on this one is equal to smoke 100 packs of cigarette. They must done away with this one. Therefore, I can repeat, fine must be tightened. If there is no law, we are the parliament. In the past, we must make a law that to give fine to this one. If 50,000 finement is less, we can take to hundreds and the 1 year imprisonment, so that these people that outlet are selling this one, they must understand that we need to protect with our nation, with our young people. With that, Honorable Chairperson, I support the recommendation and the fast implementation of this recommendation I so submit.
Thank you so much, honorable members. We are busy with serious matters today, especially issues of hubbly-bubbly. However, we have reached the time for break or health break. So guided by Rule 27 of the National Council Standing Rules and Order, it is appropriate for us to break for 30 minutes and reconvene by 10 past 11 or 11:10. Thank you so much, and we can now break.
on the report that was just presented by the chairperson, the standing committee, and as the custodian of this amendment to the bill, Ministry of Health and Social Services, I would like to appreciate and thank the committee, the chairperson and all committee members that have worked so hard and have presented this recommendation to us. I would like also to inform the House that today, the 21st of August, the Technical Committee of the Ministry of Health and Social Services has consultations with the Standing Committee of the National Assembly in Swakopmund, giving awareness of the public consultations that will start on the 31st of August going forward. On this note, I would really want to thank the members of having done such a wonderful job. As the ministry, we will use this recommendation during the consultation, and we encourage all members of this house, when you are at your regionals, to inform the public to attend these consultations. Parents, youth-led organizations, and all who has interest for supporting this bill, the amendments. I thank you, Honorable Chairperson, and I am once again thankful that the work that was done has helped the ministry a step ahead. Thank you.
Thank you so much. Any further discussion? Honorable Anguo. Okay, let's start with Anguo the Junior. Anguo the Junior before the senior.
Yes, Honorable Chair, Honorable Deputy Minister, Honorable Susan Jaleka, Deputy Minister for Health and Social Service, Honorable Member, I just want to support my chairperson on our report, the chairperson for committee, by bringing out.
Okay, maybe I did not know that you are part. You'll come towards the end.
Okay.
Okay. Thank you so much for that understanding.
All right.
All right. I now give the floor to Honorable Kuoko.
Yeah, thank you, Honorable Chairperson. I just want to contribute a bit to this debate on humbly bubbly, a new style of smoking now coming in Africa. Honestly, Honorable Chairperson, Honorable Members, I think that we don't need to compromise to this one. We have just to ban it totally out of Namibia. Because if we, as leaders, if we compromise, we, in future, as it was already said, we will not have leaders who can take care of this country. Because it is said that it's destroying. There's nothing good out of this humbly, bubbly humbly or something like that. Humbly bubbly, that one. Yeah, there's nothing good there. Honestly, there's nothing good. Just a health hazard. So, and also to us as leaders, we have just to come up straightforward that such a thing must stop to enter Namibia. Honorable Chairperson, I know that you are very aware already that Africa is already hooked up, the whole Africa, by the Westerners. They want to come back. after we got our liberations, and now they want to come back with other way of style to colonize us again. If we are weak, they will come and take over. So honestly, I'm just requesting this August House, maybe both houses, to relook straight, seriously in this matter. I know that our Deputy Minister is here, but without our strength, also they will not do anything to that. So I'm also urging our higher leaders, our ministers, presidents, that some of the approach from our friends outside Africa, we have to be very careful. While the other person coming with a such approach is bringing something else which is destroying our future and our youth. And also to this one, I used to see it's not only youth who use this type of makayas. It's everyone now. I have seen even parents and kids at home, they are smoking this thing. And be careful that if the parents are also addicted to this, that house is gone. Yeah, so I just having that a little contribution to this one, that we have to strengthen our approach to this one so that we can totally take it out of Namibia, so that we can have a very strong and a good future leaders. With those, thank you, Honorable Chairperson and members. Thank you very much.
Thank you so much. I believe it's now time for me to call Honorable Shamie, unless there is any. Oh, okay. Honorable Anguo.
Honorable Chairperson, honorable members, I rise to contribute on the report of health about health committee, certainly, about Hubbly Bubbly. I raise to emphasize on the growing impact and effects of Hubbly Bubbly among our youths. While it is often marketed as safer than cigarettes, this Hubbly Bubbly, the truth is it exposes young people, even though some elders are also included, as other honorable members alluded. This is very dangerous because what our people don't know, including the young people and some elders, is that this Hubbly Bubbly, it does also have nicotine. It can cause cancer because there are chemicals in it. We are seeing addiction, respiratory illnesses, and the gateway into other substance abuse. I therefore call on this House and member states to regulate the sale, advertising, and use of Hubbly Bubbly, and to run awareness campaigns in schools and everywhere. We must protect the health of our next generation. Honorable Chairperson, honorable members, Hubbly bubbly is not just a health issue, it is a social and economic burden. Families are spending money which they do not have. Youth productivity is declining, and our health system will pay the price later. We need clear policy, taxation, age restrictions, and health warning, just like we did with tobacco. Let us act now before it becomes another epidemic. In conclusion, Honorable Chairperson, honorable members, I am in full support of the report and its recommendations, and strongly urge that they are implemented as a matter of urgency. With that few, Honorable Chairperson, honorable members, I support the report. I thank you.
Thank you so much. I see a hand of Honorable Amkete.
Thank you, Honorable Chairperson, honorable members. To me, Honorable Chairperson, honorable members, Hubbly Bubble to me is a style of the enemy of this country to change the way and the weapons to attack our country, and they destroy it completely in silence. Therefore, I fully support the recommendation of this Committee of the Ministry of Health. And also, we as Member of Parliament to take action as soon. Hospital, all patients are when they are called to attend the hospital the time they are sick. Therefore, also as we have to take action at the right time. The right time is now. So I submit, Honorable Chairperson.
Thank you so much. Honorable Kapere.
Thank you very much, Honorable Chairperson. I rise to support the work of the committee. Now, allow me to just list a few things that I have noted. That even this packaging of this Hubbly Bubbly don't indicate the substance in it. So you have to go around to look what is really in there, in the Hubbly Bubbly. It has nicotine, which is an additive. It has tar, which damages the lungs, raise cancer risk. It has carbon monoxide. Now, Honorable Chairperson, honorable members, who would want to smoke carbon monoxide? It's quite a challenge, Honorable Chairperson. It has metal like lead and arsenic, which is very highly dangerous. So, Honorable Chairperson, I rise to support, and if at all, let's ban this Hubbly Bubbly from Namibia. Thank you so much.
Thank you so much. I now recognize the Vice Chairperson, Honorable Muteka.
Thank you very much, Honorable Chairperson. Let me first say thank you very much for that well-crafted report from the Committee of Health. Honorable Chairperson and honorable members, I rise to make a contribution on the growing concern surrounding Hubbly Bubbly, particularly its use amongst our young people. Firstly, the misconception, Honorable Chairperson and honorable members, is that apparently Hubbly Bubbly is just water. And I want to share the same sentiments with my Honorable Kapere, who just stated to say that on the packages, the ingredients that are contained in these, Hubbly Bubbly is not known to many, if not at all, everyone that uses this. Many young people also have this misconception that Hubbly Bubbly is safer than the usage of cigarettes. And one thing that they probably do not know is that water does not necessarily, or the liquid does not necessarily remove the harmful substances that are contained in this specific hubbly bubbly. Hubbly smoke contains nicotine, it contains tar, it contains heavy metals and other toxic substances. And this is what contributes to it being a harmful practice amongst our young people. I just want to also zoom in, Honorable Chairperson, into some facts here. A typical 1-hour hookah session can involve inhaling approximately 90,000 milliliters of smoke, which is around 100 to 200 times the volume of smoke from one single cigarette. In a single session, a person can be exposed to nearly 9 times more carbon monoxide and 1.7 times more nicotine than from one cigarette. Therefore, we must challenge the perception that hubbly is harmless because it passes through water. Secondly, Honorable Chairperson, we must consider the danger of secondhand smokers. I know that majority of us have made contributions in terms of what the dangers are to the one who's using it, but we also need to zoom into the one who's sitting next or to the person who's using this substance, which are referred to as secondhand smokers. This issue is not only about the person who's holding the pipe, and hubbly produces smoke from both the tobacco and the charcoal, meaning that children and family members and other persons who are nearby can be exposed. According to Namibia's 2004 Global Youth Tobacco Survey, we found that 40.3% of 13 to 15-year-olds who live in homes where others smoked in their presence, while 58.5% were exposed to people who are smoking outside their homes. Now, Honorable Chairperson have indicated that this survey is as old as 2004. However, we now need to find ourselves or need to ask ourselves, in this current situation or this year where we are finding ourselves, what do the statistics look like? But because this was 2004, we are now in 2016. What do the statistics look like? Have they been updated, and where are we at this point in time? We must also further address the issue of peer pressure amongst the young people, because entertainment areas find, to say that this is a platform for them to now get engaged in the usage of this hubbly bubbly, and they tend to do it simply because their friends are doing it or because the people around there are doing it without even them really understanding what exactly is at cost. And then further to that, Honorable Chairperson, we know very well that Namibia has the Tobacco Product Control Act, which prohibits the sale or the supply of tobacco products to persons who are under the age of 18. Our 2023 General Rules of Conduct for Learners under the Ministry of Education also specifically addresses hookah or the usage of shisha pipe, prohibiting learners from processing or using these items at school during the school activities, which is a good thing. We really do welcome it. However, we want to find out what are the monitoring and evaluation mechanisms that are in place to make sure that indeed this is being implemented effectively. I think it was Honorable Shavionja who has indicated to say, today we have devices of vapes which are as small as a pen, which means these learners can slide them into their pockets and, take a smoke break, go into the bathroom and take, a few minutes and use this. So the question is to say, in as much as we have a document that indicates this, what are the monitoring and evaluation mechanisms that are in place to make sure that indeed this is implemented effectively? Honorable Chairperson, we also need to address the information gap. Government should consider conducting an updated national study on hubbly bubbly, vaping, or any other emerging tobacco and nicotine products among young people. We need to know, where are these young people obtaining these items? How much secondhand exposure are they experiencing? And what role does peer pressure and social media play in this situation? Finally, Honorable Chairperson, prevention must be our priority. We need stronger enforcement of age restriction
greater awarenesses in schools, education for parents, particularly parents, because in most cases, Honorable Chairperson, our parents think we are just at school and we are sitting in classes and we're doing what we are supposed to be doing without even knowing that we're actually exposed to some of these substances at our schools. We must not wait until hubbly bubbly becomes a widespread issue or addiction problem amongst our young people, and we need to start acting as soon as possible. We need to make sure that we are not only protecting the young person holding the pipe, but we must also protect the child that is sitting next to the one who is holding the pipe. For those few contributions, Honorable Chairperson, I support the report and its recommendations. I thank you.
Thank you so much, Honorable Vice, for that lengthy contribution. I now recognize, but maybe before I do that, we are still receiving some detailed informations about the guests that we have received. Upon receival of such details, I will do the correct announcement. But in the meantime, I would like to recognize, okay, I'm seeing a hand of Senior Sipapela. I'm not too sure if your mic is on.
Thank you very much, Honorable Chair, honorable members of this august House. Taking into consideration the seriousness of this matter on the floor, I will seek concurrently from this House for further postponement to next week, Tuesday. Because the reason why we are looking for such, or we are putting such request to the House, is for us to acquaint ourselves with the Namibian Constitution. We need to do a thorough research so that when the recommendation came on this matter, should be a very serious one, which will give a time frame for how long can this hubbly-bubbly issue can be tolerated in Namibia. Having said so, Honorable Chair, honorable members, I would like to request for postponement on this matter till next week, Tuesday, on the 25th of this month. I thank you, Honorable Chair.
All right. Thank you so much, Honorable Papela. I'm not too sure with that feeling, because all those who indicated the willingness to contribute to the report have done so after they were given that opportunity. I'm not too sure if there will still be those that will indicate further the willingness to contribute. But other than that, it is for the House to decide whether the discussion on the report be postponed, or perhaps we conclude it today. I now put a question. If we support the idea of Honorable Spapela for the postponement of this debate. Honorable Maswao.
Honorable Chair, honorable members, thank you very much for the opportunity. I would like to propose that we continue with the debate. Looking at the contribution which has been made, we are about to conclude. So I submit that we continue this discussion of the deliberation. I thank you.
Okay, honorable members, we have two divergent ideas. One is to postpone, and the other one is to propel the idea of concluding the debate. I'm not too sure now if Senior Spapela, after some contributions, either officially or on the side from your members, whether you are still sticking to your idea or perhaps you are withdrawing the idea of postponement.
Thank you very much, Honorable Chair. I have got no objection to withdraw.
Thank you so much for that spirit, and that is the spirit of National Council. Honorable members, with your permission, if I can now go to Honorable Shemi. Honorable Shemi is given this opportunity in his capacity as the Vice Chairperson of that committee, and from there, we shall now return the floor to Honorable Svako, who moved the report for the final word. Is that in order? Honorable Shemi, the floor is yours.
Yes, thank you very much.
Honorable Shemi, my apology again. Please take your seat just for a minute. Honorable members, we have with us here are the learners, the grade 9 learners from Okaukweyo Combined School. They came to visit Parliament, and they got the information that we are in session, so they decided to come and observe the proceedings of the chamber, and it is so good. To you, our guests, in fact, they are accompanied by or led by the two teachers of that respective school. And to you, Okaukweyo School, we would like to welcome you to Parliament. Thank you so much. We would like to welcome you to Parliament, National Council in particular. This is your house, the house that is responsible for reviewing the laws. In fact, we make laws through the review functions that we do. And we wish to see you one day seated on these chairs that you are seeing here. Please study hard and make sure that you participate in the route that we have taken for you to be part of this assembly. We are busy with the Hubbly Bubbly, which is also directly affecting our children. It is best that you benefit from this discussion, and when you go back, at least be our ambassadors in relaying these informations to the rest of the learners that we have left behind. Thank you so much and welcome. You can take your seats. Honorable Shemi, the floor is yours. This time, no interruption.
Yes. All right. No, thank you very much, Honorable Chair and honorable members, the learner and the teacher from Okaukweyo School. Welcome. I want just to add this concluding remark, really to bring out some practical experiences that we have experienced in the field that really motivated us to lay our report on the recommendation of requesting the Tobacco Product Control Act to be amended so that the use of Hubbly Bubbly be banned. And these recommendations were not only coming from the committee, it's recommendations from the learner themselves that we have visited most of all the schools that we have visited in all the 3 regions, and including the teachers and the parents who were representing school boards. And some of the really worst experience is that when learners are smoking, especially herbally and bubbly, they tend now to add those ingredients, which in most cases they mix with other harmful substances such as weed, marijuana, and so on. In instances now that they are smoking even benzene, and the worst thing, some were even informed that they are also smoking the mental health pill, those pills that you give to, and including ARV. It's just chaotic. So, and this, they call it chuff. We came to learn some of the terminologies by the learners at school, because now what is common is no longer the hubbly bubbly, the big ones, but they have now those small devices. And they also sell the puff. That's how it becomes dangerous now, because the affordabilities, the learners are selling to each other for $1 just to take one puff within the school, and that's how it becomes more dangerous, because it's affordability and also the influence of peer-to-peer. And the other thing that is also dangerous is when this smoke is finished, you can actually recharge, which they call it jump start. Yeah, so you can recharge, but now the danger is when they recharge, they jump start using the plugs in the classes, sometimes in the rooms, in the hostels, and even using the bulb, the lights in the roof, I mean in the ceilings. And this can pose a danger of even fire, because tampering with power is very risky. And this is very common in the schools, because learners are also expressing that they are depressed. Perhaps there is a lack of recreation facility. And the recommendation were also to indicate, to say we need to provide more recreation facilities, in specific the demanding swimming pools, and also sport facility for soccer and netball and so on. Now, with that, I therefore, to make this remark short, I just want to acknowledge really the members for supporting for us to adopt this bill, because it's very critical, and we need to start on a major effect with the awareness. The awareness campaign should already start, and I'm happy that the Deputy Minister is here. While other efforts are being done already, please let's kick in with some awareness campaign that are showing, because parents themselves, they don't know. This thing, if you check on our report, the pictures are there. And you want us to familiarize them with, because you might also having your children at home thinking they are just having cocky pens, but perhaps they are also smoking. Therefore, we thought, and I wish our constitution could allow even our president to be given executive orders, so that by already, if we adopt this tomorrow, I mean today, tomorrow we already have the executive order that all of the smoking of herbally and chuff are banned in the country. Unfortunately, that's not how our system works. Therefore, we need to follow these procedures by our recommendation to amend the Tobacco Product Control Act, and then ensure that the recommendation of us to ban this product is realized. With those remarks, thank you very much, Honorable Chair, Honorable Member. I so submit.
Having listened to all those who have contributed, Honorable Sikongo, do you wish to reply?
Thank you, Honorable Chair, Honorable members. Yes, I have to reply.
Excuse me, Honorable, yes, your mic is on. Yes.
Yes, I have to reply in a sense of a vote of thanks to the honorable members who have that understanding of our report. That is the Harambe way and Ubuntu. In the names of two songs for the late Lucky Dube, one is Remember Me, the other one, Children in the Street. Honorable members, when we see children in the street, they are not playing. They are not playing, they are smoking. If we are not careful, our children might not reach this beautiful house. They might not reach here, as it was alluded by Honorable Kuoko, that there is another colonialism that are coming in our country to finish our young ones while they are not knowing. By the time they realize, they are gone for good. And it is us now to sing this song together. Did wherever you are, remember me. In whatever you do, I love you. We must love the children, because tomorrow they are the leaders of this house. Children, as you are sitting there, we love you. We love you and we want you to reach here. But there are many things that are roaming around within your populations, and they are not good at all for you. And Honorable Chair, as a teacher by profession, teachers who are teaching today in our schools, they are really strong. They are very strong, and we need to thank them. Let us give them hands. Honestly, it's not easy to discipline children in our schools today because of these substances that are among them. Their life as teachers are also in danger because some of them are grown up. Once you temper him, he will make sure the street you are walking, they will ambush you. And that is the danger our teachers are experiencing today. But we need to thank the Honorable Deputy Minister of Health who are here. We thank you, Honorable Deputy Minister. With those that you start already, we will rally behind you. Death or life, we will die together in the fight to rescue our young one in this republic of ours. And I still recall when we got independence, our first president, may his soul rest in peace, he said, now we are masters of our own destiny. As masters of our own destiny, we really need to work together, fight together, so that the young one in this Republic of Namibia, they must be the leaders of tomorrow. And we need to clean their roads. Young ones, when parents want to clean your roads, they are not jeopardizing your playing. They want to clean so that you can reach. See how beautiful this house is. Isn't it not beautiful? It's beautiful. Do you want to come here? Yes. But with the substance, unfortunately, you will not reach here. But you will reach here once you follow whatever we are telling you. The Minister of Education, Honorable Chair, we urge the Minister of Education to amend the Education Act, subsection 24, paragraph 1, Education Act number 3 of 2020, to relinquish the power that are now currently within the executive director to the regional director, especially when a child is to be suspended from school. Because currently, mind you, Namibia have got 1,947 schools. And now all the schools have got cases of this hubbly-bubbly. And it will be tackled by one executive director in our republic. I don't think it will be easy for him or her. And therefore, some of these functions be decentralized to the regional directors so that they can tackle it easy. And also our life skill teachers be capacitated properly so that they can deal with the discipline within our school. So with those, Honorable Chair, honorable members, we really thank you for understanding our report. All of you who took part, and this is the way to go in this August House. If we do this, we really rescue Namibians. We really help Namibians, more particularly the young one. So, a luta continua. Ya Victoria, etc. Let us continue. Thank you.
Thank you so much. With that conclusion, I would like to put a question that the report be adopted. Any objection? Agreed to? The report of the National Council Standing Committee on Health, Social Welfare and Labor Affairs on hubbly-bubbly stand adopted, and congratulations. Honorable members, we are going ahead. The Secretary will read the fourth order of the day.
Resumption of debate on the report of the Commerce Regional Council for the 2025-2026 financial year.
Thank you. When this debate was adjourned on Thursday, the 20th of August 2026, the question before the Council was a report by Honorable Monde. Honorable Maswao adjourned the debate, and he has now the floor. Honorable Maswao.
Thank you so much, Honorable Chairperson. Honorable members, thank you for the opportunity to contribute briefly to the Commerce Regional Council annual report for 2025-2026 financial year. Let me, on the onset, thank Honorable Monde for the comprehensive report which he tabled in this House. Well done, Honorable Monde. Having reviewed the report, particularly the sections on land delivery, housing and sanitation, I believe it offers a solid foundation for discussion and decisive action. Honorable Chairperson, honorable members, land and housing are not merely economic commodities. They are fundamental to human dignity, social stability, and inclusive development. The growing demand for serviced land and affordable housing requires urgent, and I repeat, urgent and coordinated interventions from all spheres of government. I therefore urge the Commerce Regional Council, together with the local authorities and relevant stakeholders, to accelerate land servicing, township establishment, the upgrading of informal settlement, and the delivery of affordable housing. On this one, I'm not only referring to Commerce Regional Council, but I'm referring to all of us who are sitting here from the 14 regions, to make sure that our people on the ground, we offer them, we service land for them, and we make housing affordable. Am I not deserving a hand of Our commitments must be matched by realistic timelines, adequate budgets, and clear accountability. Honorable Chairperson, honorable members, as I conclude, I respectfully call upon the central government to expedite the approval of alternative building material. Doing so will reduce construction costs and make housing more accessible, particularly for low-income households. With these remarks, I support the adoption of the Commerce Regional Council Annual Report for 2025-2026 financial year. I so submit.
Thank you so much, Honorable Maswal. Any further discussion on the report? I see none. Honorable Monde, do you wish to reply?
Chairperson, I think our report was comprehensive enough, and I'm happy with the comments from Honorable Maswal. So I don't want to I don't want to make more statements, otherwise you will call me to order again. Thank you, Honorable Chiefs.
Thank you so much. I now put a question that the report be adopted. Any objection? Agreed to. The report of the Commerce Regional Council for the financial year 2025-2026 stand officially adopted. Honorable members, the Secretary will read the fifth order of the day.
Resumption of debate on the report of the Ohangwena Regional Council for the 2025-2026 financial year.
Thank you. When this report, or when this debate was adjourned on Thursday, the 20th of August 2026, the question before the Council was a report by Honorable Nangama. Honorable Janse adjourned the debate, and he has now the floor. Honorable Janse.
Good afternoon, Honorable Chairperson and Honorable members. Honorable Chairperson, Honorable members, I rise to introduce the resumption of the debate on the annual report of the Ohangwena Regional Council for the 2025 and 2026 financial year. I deliberately yesterday moved for the postponement of the debate on the regional report. The purpose of the postponement was to afford the honorable members adequate time and opportunity to thoroughly peruse and study the content of the report, consult where necessary, and prepare informed and substantive contributions. I believe that this will enhance the quality of our deliberations of today and enable the Council to give the report the consideration it deserves. First and foremost, Honorable Chairperson and members, allow me to express my gratitude to Honorable Nangama for tabling this report, simultaneously commending the leadership of the SMART region for a well-crafted and articulated report. Honorable Chairperson and members, the report provides this August House with an opportunity to reflect on the Ohangwena Regional Council's performance, achievements, challenges, and the progress made in delivering essential services to the citizenry of their region. The Ohangwena Regional Council has demonstrated commendable commitment to improving the well-being and quality of life of its residents. Notable achievements in infrastructure development, service delivery, education, health, rural development, youth and sport, social empowerment reflect the Council's dedication to addressing regional priorities and creating opportunities for sustainable development. These efforts have contributed positively to improved access to essential services. It has also strengthened community participation and enhanced socio-economic development across the region. Overall, the Council's achievements are a clear indication of strong leadership, effective collaboration, and a continued commitment to responsive and inclusive regional development. The Ohangwena Regional Council continues to face several challenges that affect the effective service delivery and implementation of developmental programs. These include, not limited to, limited financial resources, inadequate infrastructure in some communities, social challenges, land administration, and economic development. Rural and remote settlements also experience challenges related to access to water, roads, sanitation, health, and other basic services. Despite these constraints, the Council continues to make efforts to address community needs through partnerships, prioritization of available resources, and collaboration with stakeholders, both internal and external. Continued support, improved resource allocation, and strengthened coordination among stakeholders will be important in overcoming these challenges and accelerating regional development. Therefore, Honorable Chairperson and Honorable Members, as we resume this important debate, our responsibility is to critically examine the matters contained in the report and identify areas that require further attention. We must consider issues such as service delivery, infrastructure development, financial management, local economic development, and the effective implementation of regional programs. Honorable Chairperson, this debate should go beyond merely considering the content of the report. It should provide an opportunity for constructive oversight, accountability, and the formulation of practical recommendations that can improve the lives of people of Ohangwena. I therefore look forward to a meaningful and constructive debate that will contribute to strengthening regional governance and improving service delivery. I thank you, Honorable Chairperson. I so move.
Thank you so much, Honorable Johnson. Any further discussion? I see none. Honorable Nangama, do you wish to reply?
Thank you very much, Honorable Chairperson. As this report is not for Nangama, it's for Ohangwena region, I would like to give this opportunity to my colleague to reply on that.
Is it your colleagues from Ohangwena? Okay, since the report is from Ohangwena, okay.
Thank you very much.
No problem. If that has been arranged like that, it's okay.
Thank you very much, Honorable Chairperson and Honorable Members. I would like to thank Honorable Nangama for really tabling this report from Ohangwena region to this very august house. And we would like to appreciate the contribution that we've made towards this report. However, Ohangwena remains a smart region that we want to deliver to the best of our interest to make sure that each and every inhabitant of Ohangwena region is benefiting to whatever the government is ready to offer. Therefore, with this report, I want to really say our team in Ohangwena is really committed to make sure that each and every inhabitant has been attended to. So every and single cent from the central government has been committed. Therefore, Honorable Chairperson, Honorable Members, in our report, we have indicated that the public resources that have been allocated to Ohangwena has been utilized to the best of our interest without even misusing any single cent. That's why all those two consecutive last years, we managed to achieve a clean audit, which is unqualified audit opinion. So, Omake, please. What does it mean? This means that the leadership of Ohangwena really is trying its level best to make sure that the service delivery is given where it's due. Therefore, Honorable Chairperson, Honorable Members, we are very much thankful to support our report and also to make a contribution towards our report. With that, Honorable Chairperson, Honorable Members, I thank you very much, and I do so submit for our report to be adopted by the Council. I thank you.
Thank you so much. That was a hand that got extended to you. I'm now getting it back to the owner. If you still wish to reply before we conclude this matter.
No, thank you very much, Honorable Say. I just want also to give my appreciation to the House for contributing on our report, and I, with due respect, wish also this report to be adopted. Thank you very much.
Thank you so much. I now put a question that the report be adopted. Any objection? Agreed to. Thank you so much. The report of the Ohangwena Regional Council for the financial year 2025-2026 stand adopted. Congratulations. Honorable members, we are moving ahead, and before we take the next item, I would like to caution you and ask you humbly that our chairs are getting empty and emptier. So at least I know how important you are, more particularly in managing the affairs that you are entrusted with. But at least if we can just keep on for the next 30 minutes for us to conclude the program that we have, that's when we are now going to attend to all those official activities. We are going ahead, and the secretary will read the I'm not too sure whether Honorable Sesulu, Sesuni, I'm sorry, where did I get that name? Whether you would like to contribute already before I introduce the Yes, honorable members, I was informed that the next item, even before I introduce it, was supposed to start with Honorable Joseph, and equally so was I informed that Honorable Joseph's committee is with the OPM. So maybe that's the reason why the chairs are empty and I was not informed. My apology for that. We are now going to go ahead with item number 7 on our order paper. Secretary, if this Honorable members, my apology. Though Honorable Joseph is not here, we will still continue because this is the regional report. Other members of that region are here. I now ask the secretary to read the 6th order of the day.
Resumption of debate on the report of the Erongo Regional Council for the 2025-2026 financial year.
Thank you so much. When this debate was adjourned on Thursday, the 20th of August 2026, the question before the Council was a report by Honorable Brandt. Honorable Joseph adjourned the debate, and he has now the floor. Like I said, he is not here, but any other member can take that task, either for postponement or for contribution. I now ask for the replacement. Honorable Chavenja, I'm seeing his hand.
Chair, honorable members, I think the best way also to do justice, because we need to do things in sequence. I would then want to postpone the report, just also to make sure that the honorable member who have then moved for postponement being given the necessary time because of the input. Because I'm just fearing that if we continue, we might adopt the report and not miss out on the contribution from the honorable member. So I then ask for the postponement of this report to next week, Tuesday.
Thank you so much.
Thank you, Chair.
Any objection to that? Agreed to. Having used the rule number 56 in our National Council Standing Rules and Order, we agreed that the report be postponed to Tuesday, the 25th of August 2026, and so it stands. Honorable members, as earlier on mentioned, we are going ahead, and the Secretary will read the seventh order of the day.
Resumption of debate on second reading of the Mental Health Bill, Bill number 8 of 2025.
Thank you. When this debate on the bill was adjourned on Thursday, the 20th of August 2026, the question before the Council was a motion that the bill be now read a second time. Honorable Garwap adjourned the debate, and he has now the floor. Honorable Garwap.
Thank you, Honorable Chairperson. Honorable members, I rise to make a brief contribution in support of the Mental Health Bill, Bill number 8 of 2025. The bill before us seeks to regulate mental health care in Namibia in a manner that promotes the dignity, autonomy, and human rights of persons with mental health conditions, while advancing their optimal mental, social, and physical well-being. This mental health bill gives effect to the principles and obligations contained in the United Nations Convention on the Rights of Persons with Disabilities. It also seeks to repeal and replace the Mental Health Act of 1973, introducing a modern legal framework and providing for important related matters that are long overdue. I therefore support the Mental Health Bill because it provides a modern right-based approach to mental health care initiatives. However, as National Council, we have the responsibility to ensure that this legislation benefits all Namibians, particularly those living in rural constituencies, settlements, and underserved rural areas. The success of this bill will ultimately depend on its implementation. We therefore need adequate and sustainable funding, qualified mental health professionals, accessible healthcare services, effective referral mechanisms, reliable transport systems, and consistent support for children and young people and other vulnerable members of our communities. Mental health care must in principle not be concentrated only in major towns and urban centers, as it was alluded in previous contributions. It must reach our communities where our people live, work, and raise their children and families. The bill changes Namibia's approach from control and confinement to rights, treatment, rehabilitation, and community-based care. I therefore support the bill and call for its strong and effective implementation, ensuring that no Namibian is left behind in accessing mental health care. I thank you.
Thank you so much, Honorable Garab. We are going ahead. Honorable Shimi, I'm sorry.
Yes, thank you very much, Honorable Chair, Honorable Deputy Minister, Honorable Susan Jaleka, Honorable members. I raise to support the mental health bill tabled before this House. Honorable Chair, this bill is important because mental health is not an issue that affects people who have already been diagnosed with a mental health condition. It affects our family, our workplace, our schools, and our community and our economy. Let me illustrate this with a simple example. Imagine at your workplace where
My apology, Honorable Shimi. Honorable Garab, your mic is on. Okay, you may continue.
Yes. Imagine at your workplace where an employee who suddenly become behaving in a way that is completely out of character. And you will be now wondering, and the rest of the fellows, what should be done? And a friend of mine was also telling me about a scenario that happens at their workplace. Suddenly, this employee just start coming to work and stand. The CEO himself didn't know what to do. He locked himself in the office. So, therefore, I support this bill in a way that the intention is really to give a platform on how some of these scenarios will be handled. And that's where stigma become a problem. We must create a culture where mental health concerns are treated with the same seriousness and compassion as a physical health condition. Mental health condition patients should be able to seek assistance without fear of discrimination or losing their dignity. Honorable Chair, the statistic should concern all of us. According to the information presented by the WHO and the government of Namibia, 542 suicides and 2,937 suicide attempts were reported in Namibia during the time of 2023 to 2024. These are not mere numbers. Behind every number is a Namibian family, a workplace, a community, and life affected. This tells us something very important. Passing the bill is only a beginning. The implementation must follow. Honorable Chair, honorable members, in particular welcoming the provision of dealing with the care and administrations of the property of a person with a mental health condition. The bill provides for the appointment of an administrator, application for Master of High Court, court orders, confirmation of appointments, and the power and duties of administrator, including mechanism for review or termination. These provisions are important because the person experiencing the serious mental health condition may temporarily be unable to manage their financial affairs. Without proper safeguarding, such a person can easily become vulnerable to exploitation by relatives, friends, or other individuals. The bill therefore has an important protective function, and it is not only about treating a person with mental health, it is also about protecting their dignity, properties, and financial interests. At the same time, I believe that the regulations and implementation framework must provide stronger safeguard, transparency, and accountability so that administrators act strictly in the best interest of the person concerned. Honorable Chair, Honorable Member, my second point is that we must ensure that the law is matched by the resources. There is a risk that we pass progressive registration but fail to provide sufficient funding for its implementation. I therefore encourage the government through the regulation, budget process, and implementation plan to establish a clear and measurable financing commitment for mental health service to be prioritized. For example, the regulation will indicate to say even 1% compulsory of the budget to the ministry should be allocated for mental health program. In this way, financial priority is secured and is not left to individual to decide. Because you find some administrators, they only prioritize this when they go in the office. But if this is regulated in the law to say already when we pass this bill, certain percentage of portion money should be prioritized because this bill will come with programs that needs to be prioritized, and we guarantee ourselves that it's going to be implemented successfully. In addition to that, funding priority should include provision of additional mental health professions, training and continuous professional development, scholarship and study opportunity for Namibians specializing in psychiatric, psychology, and psychiatric nursing, occupational health therapy, and related fields. And also improve remunerations and incentive to attract and retain specialized personnel. Mental health infrastructure and community-based service and rehabilitation and reintegration program. The WHO latest data indicate that Namibia has 56 hospitals attached outpatient mental health facility, but no reported community-based mental health outpatient facility. Therefore, interventions are also reported to be available in less than 10% of primary health facilities. This demonstrates why implementation cannot be limited to Windhoek or the few major hospitals. Mental health services must reach out to our regions, constituency, rural communities, and primary health care facilities for prevention, awareness, and fighting stigma. Honorable Chair, Honorable Member, my third point is that prevention must receive equal attention. We need provision of regulations to be developed to provide for sustained public education, awareness campaign, and we must challenge the myth through adequate awareness. We should also encourage employers to establish basic workplace mental health programs, including awareness, early identification, referrals, and appropriate support. A person should not have to reach crisis point before receiving help. Honorable Chair, Honorable Member, I therefore call for a clear national implementation plan to accompany this legislative. The plan should identify who is responsible for implementation, what resources are required, where the service will be established, how many personnel must be recruited and trained, and lastly, what target must be achieved and within what time frame, and how Parliament and the public will monitor progress. Honorable Chair, Honorable Member, a good law without implementation remains only a promise on paper. We therefore need infrastructure, human resource, financing, monitoring and accountability, and political commitment. In conclusion, the mental health bill represents an important step away from an outdated system toward a modern, right-based and patient-centered approach to a mental health care. The bill seeks to replace the Mental Health Act of 1973 and place a greater emphasis on dignity, autonomy, rights, community-based standard, and protection of vulnerable persons. Let us therefore not only pass this bill, but let's fund it, let us implement it, let us educate our people about it, let us fight stigma. And most important, let us ensure that every Namibian who experiences a mental health condition can receive care with dignity, patience, and hope. With these few remarks, I raise to support for this August House to pass the mental health bill. I so submit. Thank you.
Thank you so much. Honorable Ngunaia.
Honorable Chairperson, honorable members, good afternoon. And thank you very much for opportunity. And just rush to join other honorable members in contribution to this very important bill, Bill 8 of 2025, mental health. Honorable Chairperson, honorable members, we are a very small nation in terms of population. Even Her Excellency, Dr. Triple N said, we are too few to be hungry, to be poor. Yes, I know her very much. And those few people are confronted with contemporary challenges, including suicide, gender-based violence, domestic violence. Even those who are supposed to protect their families, they are the one abusing and killing their own children today in Namibia. That is the nation that we are talking about. Substance abuse, family breakdown, unemployment, poverty, and anger. To the extent of our late President Dr. Hage Geingob, may his soul rest in peace, once asked why Namibians are so angry. Because people are going through a lot. These challenges demonstrate that mental health cannot be treated as an issue affecting only individuals who have been diagnosed with a mental disorder. Mental health is a national development issue. It affects families, children, education, workplace, and the relationship, and many more. For this reason, we need as a country to strengthen mental health services and ensure that qualified mental health practitioners are accessible in every region, constituencies, and community in rural and underserved areas. Otherwise, people in rural areas must travel considerable distance before they can access appropriate services. And that's why even sometimes people in rural area tend to witchcraft for solution because they cannot access these services are far from them. And families who lose loved ones should have access to grief counseling. Survivors of serious crashes should be screened for psychological distress and referral for appropriate treatment. I was talking to one social worker 2 weeks back. I was asking them, how do you deal with a person? Sometimes they were traveling to certain area with a family, and it happened that they were involved in a car accident, and only one person survived among the family. And this person was admitted, and after discharge, how do you deal with this person? That social worker said, we don't have programs, so to say. We talk to them just as a matter of encouraging, but then we let them to go out and face the challenges. Can you imagine the house which was having 5 family members and you are the only one survive, and you have to go and face and go enter in that house? How will that person feel? Therefore, there must be a proper program to counsel and to treat these people. Otherwise, this what we want to address will never get any solution easy. And emergency and healthcare personnel should also have access to psychological support because of repeated exposure to traumatic events that can affect their own well-being. We cannot build a healthy nation while leaving mental health behind. Our history has left deep wounds. Our present circumstances continue to create new trauma. Therefore, all of us, we must join hands and see to it that we mobilize our community to accept one another. We know the people who are committing suicide today are not those who are not working. Even those who are working with a well-off payment, they can still commit suicide. Because they have issues, we must encourage one another to share our problem with one another, even with our supervisors, so that we find a solution before it's too late. If we want healthier children, healthier families, safer community, and a strong nation, we must invest in the psychological well-being of our people. A mental health in Namibia is not a luxury, it is a nation necessity. Healing the nation requires reaching the people, and reaching the people requires mental health practitioners in every community. With these few remarks, I support the bill, and God bless Namibia.
Thank you so much, Honorable Veiko.
Honorable Chairperson, honorable members, good afternoon. I rise to support the Mental Bill, Bill 8, 2025. Many of the critical points have already been eloquently raised by honorable colleagues before me, and I associate myself with those sentiments. However, I will compelled to add my voice, not to repeat, but to underscore and to bring the lived realities from our communities. That makes bill urgent for Namibia today. Honorable members, the need is before us. For 52 years, our country has been governed by the Mental Health Bill Act of 1973. That was an act of confinement, not care. An act that did not recognize the inherent dignity of Namibians living with mental illness. Today, we have a historic opportunity to correct that imbalance, and we must face it. Honorable Chairperson, honorable members, we have fathers and mothers who drink to forget, children who drop out because of depression, elders locked in rooms because families do not know what else to do. They are not guests, they are sick. Distance and stigma have denied them care. If one drives through towns and villages across Namibia, 2 out of every 20 people live with mental illness. This shows the scales of the challenges before us. In my constituency, at a place called Nambawa in Ruparas, there are twins who lost both parents and are now living in deplorable condition. They live without support, care, and without intervention. They are vulnerable children left behind to suffer alone. What is observed in Zese is also evident in many other villages such as Nautoba and Kayeura, in Kavango West, as well as in other towns across Namibia. Why the challenges are the same? Towns typically have at least a hospital, whereas villages often have no such facilities and underserved. Many cases go undetected for years because there is no screening at clinics, and our communities are not sensitized to early signs. In our culture, persons with mental illness are often hidden out of shame, distance, and transport costs to Windhoek for rehabilitation have denied many rights to care. By the time people seek help, families are broken and stigma has already set in. What I will support in the bill is that, Honorable Chairperson, honorable members, I welcome this bill for 3 reasons: rehabilitation and care. The planned mental health hospital in Rundu will serve both Kavango regions. It will help with rehabilitation so that when people recover, communities can accept them back. Number 2, early diagnosis. This bill provides the screening at the primary health care level and for community awareness. A nurse at any clinic or hospital will be able to identify and refer cases yearly. 3, protection of rights. Part 3 and Part 5 of the bill protect dignity and establish review boards. This means families in the constituencies will have somewhere to take a complaint. Recommendation for rural implementation. Honorable Chairperson, honorable member, to ensure no one is left behind, I make the following recommendations. A, prioritize the most vulnerable. I respectfully call upon the Ministry of Health to conduct immediate outreach in affected areas such as Nambala in my constituency. The twins I mentioned must be identified and brought into care and social support. No child must be left in a deplorable condition. B, decentralized services. I request that critical facilities serving constituencies be designated as mental health service points. We need trained nurses, social workers, and reliable supply of medication. C, inclusive oversight. Review boards must include members from Kavango West who have knowledge of serving people with mental health condition, and they must visit the region regularly. D, partnership with community leaders. In Musese, as in many regions, traditional authorities and churches are respected and trusted. Let us partner with them for awareness, screening, and referrals. Honorable Chairperson, Honorable Member, this bill corrects a historical wrong. It tells every Namibian, whether in Windu, Rundu, Kurenkuru, or Rupara, that you matter. You have the rights, and recover is possible. I support Mental Health Bill, Bill 8, 2025. Let us fund it. Let us staff it. Let us build the Rundu Mental Hospital, and let us take mental health to the last village. Honorable Chairperson, Honorable Member, I so submit.
Thank you so much, Honorable Veiko. We are going ahead. Honorable Monde.
Thank you very much, Honorable Chairperson. I wish to seek the concurrence of this August House that we postpone the debate or the discussion of the mental health bill to Monday, 24 August, because I think it's many of us that want to contribute to this important bill and make a meaningful contribution so that this law is passed in a state that is going to be effective and beneficial to our Namibians. So I still submit to Honorable Chairperson.
Thank you so much. Before I ask a question, whether in support or not in support to the feeling of Honorable Monde, I would like to inform the House that I have about 9 MPs who so wish to contribute. Just to let you know that the bill is attracting the attention of about everyone, and is now for the House to decide whether what Honorable Monde has suggested is practically so, or we reject. I now ask members, those that are in support, because we have so many people. If we shift, it means they will rightly so contribute on Monday. Any support? Thank you so much. Any objection? I see none. The debate on the second reading, Mental Health Bill, Bill 8 of 2025, stand postponed to Monday. So agreed. Honorable members, if there are those members who so feel that you would like to contribute after Monday, please, I'm requesting you so that we can all contribute on Monday so that the other subsequent days be used for committee stage and the third readings, because we have only 2 weeks for this session, and as a result, we have to use the 2 weeks accurately. It's not really an order, but it's a humble request, and if it is accepted, I am really happy to see that happen. Honorable members, those were the orders of the day. I shall now ask the Deputy Chief Whip, Honorable Shikulo, to adjourn the House.
Thank you very much, Honorable Chairperson, honorable members. The House is adjourned until Monday, the 24th of August, 2026, 9:30 sharp. Thank you very much.
Thank you so much. Any objection to that? I'm expecting some objections. Huh? Any objection to that? Agreed to? The House stand adjourned until Monday, 9:30 sharp, so agreed.